Welcome to Psych 3310 Abnormal Psychology. My name is Dr. Sam Fiala, and I will be your instructor for this online course. In this video, we're going to go over a couple of things. First, tell you a little bit about myself, talk about how you can stay in touch with me and with each other, talk about the course objectives, what we hope to accomplish taking this course, the stuff you probably most want to know about in terms of what are the course assignments and assessments, grading policies, talk about how to interpret the course calendar, and then a few other policies and thoughts about this course. So starting off, Doctor Who, well, Dr. Fiala. And yes, I also do like Doctor Who, the TV show. I encourage you all to watch it. Anyway, PhD in clinical psych, and I'm a licensed psychologist. I went to undergrad at Southwestern University down in Georgetown, and then graduate school for master's and PhD in clinical psych at Texas A&M University in College Station. And my area of emphasis there was in clinical child psychology. After finishing up my doctorate, I went to Texas Tech for internship and worked at the Student Counseling Center there, seeing college students in their counseling center for a year. And then I graduated, and then I stayed on at Tech, working in the counseling center doing postdoc, and also began working for early childhood intervention in Lubbock, where we delivered in-home psychological services to families with kiddos ages 0 to 3 with developmental delays and disabilities. Then moved back to Texas after a couple of years and kept working for early childhood intervention here in Bell County. Taught for a year down at Southwestern, my alma mater, and then started at A&M Central Texas. I stopped working for ECI just a couple of years ago, soon after I became department chair. Been here at the university for 10 years. Started when it was Tarleton State University, Central Texas. So I've been through a lot of changes and excited to see it continuing to grow and develop. I'm now an associate professor, and as I already kind of referenced, I'm the department chair for the Counseling and Psychology Department in the College of Education. Married to a physician, got 3 school-age kids. So when students tell me, "Oh, Dr. Fiala, I'm so busy, I got so much going on," I often identify, "Yes, me too." And I appreciate we all have lots going on, and I try to be respectful of your time with the way I design courses, trying to get the most information to you and the best assessment of your work, while also not giving you busy work or assignments that don't have any educational value. In terms of research interests, kind of a jack of all trades in many ways. I teach the graduate research methods course and statistics as well. So I've got some expertise in research and methodology, which allows me to work on a variety of projects with other faculty. For stuff that I'm interested in looking at more recently, looking at triggers for arousal and stress for individuals that are exposed to trauma, including those with PTSD and post-traumatic symptoms that don't rise to the level of a diagnosis. There's a shot of my crew, kiddos. In terms of staying in touch, if you look at the syllabus, it has my office phone number. This summer I'll be in the office most mornings, be back home still working, but working from home in the afternoons. You can email me. Email is on the syllabus as well. You can also message me through Canvas. That just comes straight to my email. So either way you do it, I'm going to receive those messages in the same place. And I will try to respond to you within, what did I say on syllabus? I can't remember, 24 hours, 48 hours, pretty quickly. I'm pretty good about that. Monday through Friday. On the weekends, I'll probably be less responsive. But by Monday, I'll get back to you. And if I don't, if you email me and it's been 3 days, email me again, because I get so many. Sometimes messages get pushed to the bottom, and then I miss them. Office hours this summer, I'll be there up on campus for those of you who are going to be in clean. Mondays 8 to 3, and then in the mornings Tuesday, Wednesday, and Thursday. I'll probably be up there a lot other than that, but can't guarantee it. So just email me to make an appointment. And even for those times I have office hours, it's probably good to email me if you want to come in, because I've got some other duties in terms of covering things in our clinic that may be where I'll be on campus, but it may pull me out of the office unexpectedly. WebEx is the technology we're currently using for video, chat, audio conferencing. I'll set that up on our Canvas webpage. And so if you want, you can also schedule appointments to meet with me via WebEx if you want to have a conversation that way. Which, for those of you who are in fact at a distance, I do encourage that. Even having your webcam is even better than just a phone call, because there's some of those things you can't pick up without the visual cues. I'm also going to have a discussion board posted in the class that's for course questions, and that's something I'll check sporadically, but really that's for you to help each other. If you're like, hey, I don't understand this part of the syllabus, anybody else have this confusion? And then maybe another classmate can respond to that. So that's for you all to kind of communicate with each other about course questions. And again, I'll check in on it once in a while. But if you have a question for me, obviously, email me. Okay, the course objectives, what I hope you get out of this course. One of the big things will be being able to identify the boundaries between normal behavior, abnormal behavior, and psychopathology. And when I say identify the boundaries, really I mean being able to generate and ask the questions needed to identify those boundaries, because those boundaries shift. They shift across time as there's developments culturally, politically, and also scientifically as more knowledge comes in. Where the boundary lies and what kind of boundaries there are change. So you need to be familiar not just with, oh, well, if there's this behavior, that's abnormal. Well, maybe why is it considered abnormal? Why is it maybe considered psychopathology? And once you know the why, and you know, okay, well, to what degree is that true? Now you can be more flexible in your thinking as the answers to those questions change. Want you to be able to apply diagnostic criteria. You know, I'm talking about the Diagnostic Statistical Manual, volume or issue 5, where we're at now with the American Psychiatric Association. It's what professionals use to apply diagnostic labels to people identified as having a mental disorder. I don't expect you to finish this class and be able to go out into the field as a, and diagnose people like a psychologist. What I do want for you is to be able to think diagnostically, to be familiar with the major diagnostic categories, and then also to be able to, again, ask those questions. Okay, well, what do I need to know to determine if this is major depressive disorder or bipolar disorder or dysthymic disorder? So what are the types of questions you need to ask in terms of types of symptoms, severity, duration of symptoms, level of dysfunction, those types of things. That's the kind of things I want you to be able to do when you finish this course. Also want you to be familiar with the theories of etiology of psychopathology, so the causes. And again, they are theories. Like, nobody has the answer. Oh, this is caused by this. And if for any disorder that's in the DSM, somebody points to it and says, okay, well, the cause of this is definitely this, we know it for sure, that person is probably trying to sell you something. Because no, we don't. We don't fully understand these things that we label as disorders, but there are some very interesting theories about what causes them. And again, you need to be familiar with what those theories are. Also want you to be familiar with current treatment approaches. Again, don't expect you to be able to go out and deliver treatment. This isn't a graduate course in therapy, but we will have some overview of, okay, well, once we identify a disorder or a group of disorders, okay, so if you have some anxiety, if you have some phobia, what types of things might that person experience in a treatment setting that are shown to be effective, that have some empirical support? And then one of the biggest ones is I want you to be able to think critically about the claims of researchers and authorities as they pertain to abnormal behavior. So when somebody says, oh, okay, well, if somebody has these behaviors, they're abnormal, or they have psychopathology. Oh, this is autism, this is schizophrenia, and here's what it means. Again, nobody has the final answer. So I want you to really be a bit skeptical about claims, but not just disbelieving, but to be able to critically think about claims people make, and again, know, well, what kind of questions do I need to ask to determine the degree to which I should have faith in what this person is saying? And also, where can I go to find more information to verify for myself the degree to which their opinions, their statements are supported by established science. Okay, so probably what you're most interested in, the course assignments. The first thing that you'll do is this "Hey, what about" assignment worth 50 points. And it's just kind of an introduction discussion posting assignment where you're going to post on a discussion board labeled "Hey, what about?" Introduction about yourself. Hey, my name is this. A couple of things about yourself, as much as you care to share. And again, I should say here, this is not a course where I expect people to come in and say, hey, I have experience with this because I'm diagnosed with this, or my mom is diagnosed with that, or my cousin is diagnosed with this. If you want to share that information, that's your right. I certainly wouldn't encourage you to do so. I don't think that this class is an appropriate forum to share that type of personal information. If you want to have conversations with professionals about that, I highly encourage it. And I think you can still talk about everything using more general terms without having to share necessarily personal experience. So in your introduction, share as much information about yourself as you want, but mostly about your interest in psychology. But in that posting where you're introducing yourself, I also want you to ask a question. So I'll post a question to the class about abnormal behavior. And this is really wide open. Just anything that you've been wondering about. It can be abnormal behavior in general. It can be a particular behavior. Hey, when people have eating disorders, what does this mean? Why do they do this? How come this is this way? So just post some question. Okay, so that'll be the first part of the assignment. And that'll be due by Wednesday, June 6th. And then the second part will be to go in and try to answer somebody else's question. And I just want you to just read their question and go, I don't know, maybe this. Just off the top of your head, what do you think the answer is? Don't Google it. Don't go to Wikipedia. Don't go to your textbook even. Just whatever you think. I kind of heard maybe could be the answer. And post a reply to at least one classmate. And if somebody already there's like no questions left that haven't been replied to, that's fine. You can reply as well because maybe you have something to add to what somebody else said. That's okay. But if you notice there's a question that hasn't been replied to, I would prefer that you reply to that one rather than just adding on to something else, unless you just really want to. Okay. So anyway, that answer will be due by Monday, June 11th. Okay. Next assignment, we'll talk about the mental illness in the media. Another discussion posting assignment worth a total of 150 points. And there's going to be multiple discussion postings throughout this semester. So what you'll do here is there's about 10 chapters we're going to cover in the text that are about categories of abnormal behavior and disorders. For example, there's a chapter on anxiety disorders. So for each one of those chapters, you're going to post something on this discussion board, mental illness in the media. And so you're going to have a total of at least 10 posts, because one for each one. And the postings can either be an original posting where you're saying something, or it can be a reply to somebody else. So when you're saying something, your original post, what that should be is you identify a fictional character, so from TV, movies, books, internet memes, Broadway, whatever, that you believe exhibits some of the behaviors that are discussed in that particular chapter that you're referencing. So if we're talking about anxiety disorders, you go, oh, you know what, I was binge watching this thing on Netflix the other day, and this character in this show, they totally have OCD, or they clearly have generalized anxiety disorder because whatever, and then name some behavior, or behaviors that they exhibit that makes you think they might meet criteria for that disorder. And again, they don't have to meet every possible criteria. It's like, oh yeah, I went through the list and they had it for 6 months and da-da-da. No, if it's, well, it could be this. Here's why it could be this. So that's an original posting. So you'll do at least 4 original postings and also at least 4 replies. But again, 10 total postings. So if you do 4 of one, you're going to do 6 the other. And you can do more. Anyhow, when you make a reply posting, this should be where somebody else has said, hey, I think this character has this, might meet criteria for this diagnosis. And your reply should be either, yeah, I agree, and here's another thing that is consistent with that makes me think you're right. So citing some more behaviors that character does. Or you can say, no, that character doesn't meet criteria for that. There's no way, because yada, yada. So you cite some other behaviors that would be inconsistent with that diagnosis. Okay. And again, it's not we're trying to fight with anybody. It's just sharing ideas, meant to be in good fun and meant to get you to think critically about the information and try to apply it to things that you're coming across in your daily life. Okay, so again, 10 total postings, one for each chapter, and you can do more. It's kind of a fun assignment. If you think of, oh, I thought of another one, yeah, post another one. But at least one posting, either an original posting or reply for each of those 10 chapters. And those due dates are in the calendar. Okay, the diagnostic assessment assignment. This is another fun one. So you're going to be assigned by me to an assessment team. I'll randomly put you in groups and I'll let you know, hey, here's who's in this group. And what you're going to do is work as a team to try to diagnose a patient. That patient being me. I'll be role-playing some fictitious patient. I'll have some pathology in mind that I'm going to pretend like I have. And you as a team are going to be asking me questions on a discussion board. So you post question, I answer, post question, I answer. We're trying to suss out, okay, what might they have? And do they meet criteria for the thing we think they have? So there's deadlines in the calendar because you've got to ask, each person on the team has to ask at least 5 questions. So, you know, first question asked by this date, second question by this date, third by this date. And again, you can post them earlier, but I would recommend that you don't just, okay, here's 5 questions, ask a question, wait for the response, and then ask another question, because the answer may dictate where you need to go with your next question. Right? And part of what you're going to be graded on is the quality of your questions. So when I'm looking at your questions, is it clear that you looked at, okay, after the first couple of questions were asked, did the next question you ask, does it make sense? Like if somebody asked something that, have you ever, are you using any substances, for example, cocaine, alcohol, whatever, and I say no, and then you come back a few questions later, have you used cannabis? Well, that's a bad question. They already said no to substances, right? So you'd be graded down for that. So do pay attention to what's been asked, what's been answered. And so that'll go across the semester asking the questions. And then after that cutoff point, after the 5th question is due, then there'll be a due date for you to submit. Okay, here are all the questions I asked. And here's what I think the diagnosis is, and here's why. So that's what it'll be, just a little half page. I think the meet criteria for this disorder or these disorders could be more than one, because they said they meet the following criteria, and you can cite criteria from the DSM of behaviors that are consistent with those diagnostic categories. So that's something you'll be collaborating with your classmates on, asking the questions, but then when you go to make your diagnosis and your justification for why you had that diagnosis, that should be your own independent work. Ask the questions together, and at the end, you're on your own. Okay, so again, that's a back and forth discussion, and that kind of a report at the end where you say what you think I was role-playing. Last major assignment would be the research paper. This will be a 5-page APA paper where you'll be citing empirical evidence about some treatment of mental disorders. And it could be a treatment approach for one particular disorder or a treatment approach that's used for a variety of disorders. The main things I'll be looking for here, and there will be a rubric posted online for this that kind of clearly specifies what I'll be looking at. But what I want for you to do is go find empirical sources. And when I say empirical sources, that doesn't just mean not Wikipedia. It means articles, journal articles that are published in peer-reviewed journals that are reporting the results of a study. So it's going to have a participant section, a method section, a results section, a discussion section. There's lots of articles that you can find even on PsycInfo. They're in good journals. They're academic journals. They're peer-reviewed, but they're not empirical. They're just theory papers, or they're review papers. They're opinion papers. I want you to read actual research, the results of studies, and report back on something about treatment. So you need to cite empirical sources, do that appropriately. And then the other big thing that I want you to do is have some argument you're making in your paper. So this isn't just a book report about, here's some information I found, here's some things. No, have some point you're trying to make. This is the best treatment. This treatment is ineffective for this group. This treatment is too expensive. This treatment is unethical. Whatever it is. And you're not going to know what point you're trying to make until you start digging in and reading the articles. But as you're reading articles, hopefully something will be building in your mind. Oh, okay, I'm getting an argument here I think I could make about this treatment or about this treatment issue. And again, before you even start that paper, do look at the rubric. And as I referenced in the syllabus, I do recommend you make full advantage of the Writing Center. Obviously, if you're on campus, go there face-to-face and meet with a tutor. But they also have some online writing tutoring services, which I'll have a video on Canvas about those services. They're good. They help students' papers are better, and they score higher when they use the Writing Center. So I do strongly encourage that. Okay, course assessments. So quizzes, chapter quizzes. So we've got 4 quizzes. At first, when I was designing the class, I had like 13 or 14 quizzes, 1 for each chapter. But I thought, no, that's too much. 8 weeks, it's too crazy having a quiz like every other day. So we'll have larger quizzes, so more chapters covered in a quiz, typically about 3 chapters per quiz, but just 4 of them worth 50 points apiece. And they're going to cover both the assigned readings, so the chapters in the book, as well as the lecture videos that I'll post for each topic. So my advice, read, then watch the video, then take the quiz. And it is an open book quiz. It's also timed. It's not an open Google quiz. It's not a ask your friend quiz, but it is open book. So you can have your book, you can have your notes. That's fine. Just work independently and don't try to Google answers, because maybe a lot of structure questions where if you Google it, I'll know and you'll get it wrong. The quizzes will have due dates, and if you miss the due date, you can still take the quiz for 2 more days. But after that, the available date, then you won't be able to take the quiz, and you'll get a 0 for it. So make sure you stay up on those, because again, even though there's only 4 of them, summer goes fast, and I am aware of that. And they won't all be up, the first day of class, but they will be up at least a week in advance of the due date. So if you are needing to travel, or you're going to be gone for some time, you can, and you want to knock something out early, you can. But you can't knock it all out early, because that doesn't lead to good learning outcomes overall. All right, final exam. It's going to be obviously online. 3-hour time limit. It will be comprehensive, so it will cover everything we've covered in the course. All the readings, all the lecture videos, everything, as best as I can build it. And really the emphasis whenever I create exams is, my goal is to make them where you have to be able to apply knowledge to answer the questions, not just regurgitate facts. Because again, it's going to be open book. So I don't want to see how quickly you can turn pages in your book to look up a definition. I want you to be able to apply those definitions, apply those concepts, those theories, and critically think about the material. And so the questions on the final exam will be designed. It's my hope to make that happen. Be largely multiple choice, fill in the blank, but some essay possibly. And depending on how the summer goes, we may have a review for the final exam. Certainly my goal to do that, but no guarantees as of right now. Okay, grades. Getting a grade versus earning a grade. Students don't get grades. I don't give them, oh, why'd you give me a B? Why'd you give me a C? Which nobody ever asked why I gave them an A, which is weird. But I don't look at it that way. I see it where students are earning their grade. If you earn an A, congratulations. If you earn a B, still congratulations. If you earn a C, maybe congratulations, depending on how your semester went. Related to that, I am aware that a variety of factors influence what grade you're going to earn in this course. Talk about this in the syllabus in terms of it's going to be not just your mastery of the material and how much effort you put into learning. It also has to do with how well I'm conveying the information, how accurately I'm assessing your knowledge. And then to some degree, it also has to do a bit with luck. Like if things go fairly smoothly for you this summer and you work hard, and you're smart, you'll probably get an A. But if you're the smartest person in class and you bust your ass, but you get in a car wreck partway through the semester, or someone in your family has some tragedy that is distracting to you, it's going to be much harder to earn an A or maybe even a B, and that sucks. But I can't grade on a life curve. I wish I could. I wish there was a way to do that, but I can't. I just want to let you know that I do recognize that you might be a really strong student, you might be a great student. You might not get an A. You also might be kind of a crappy student and luck out and get lucky and get an A. I don't think that happens too often. The point being, grades don't define you. I will try to accurately assess what you've learned in your mastery of course material to the best of my ability. But just know that it's an imperfect measure of your knowledge and of your performance. In terms of giving you feedback and posting of grades, I'll try to turn things around within a week to 2 weeks. I know in summer semester is super short and there's a lot of stuff coming at once. But whenever I do give you stuff back, please do look at the feedback. Even like the research paper, you won't get that back because it's due at the end of the semester. So you won't get it back till probably, the semester's over. But I will put comments throughout your paper with track changes and inserting comments. Please do look at that because I'm not giving you that feedback for my benefit. I'm giving you that feedback to help you become a better writer. And when you take other classes with me, other classes in the department, even in other departments, if I'm giving you some corrective feedback, please take advantage of that. Okay. The late work policy, turn an assignment in after the due date. You receive a grade reduction of 10% for each day that it's late with a max reduction of 50%. But no late work will be accepted after 12 p.m. on July 26th. So if there's something kind of due at the beginning of the semester and you don't turn it in, if you turn it in at the end of the semester and it's before July 26th, you could still earn up to half of the points because I really want you to turn things in. The assignments aren't there for me. They're there both to assess your learning and also they are learning tools. So I want you to do them. Even if you're not going to get all the points, 50% is way better than 0 points. And the number one reason students don't pass classes is not turning things in. So please turn things in. Obviously, turn them in on time. You get all the points. But if you turn in late, I want you to still get something out of it. Okay, the calendar. You got the dates, when the video lectures and topics will be covered, the readings associated with those, and then due dates for assignments. Please take note that there's not a kind of consistent pattern for due dates. It's not the way that summer works. It can't be, oh, quizzes are always on Fridays. I think the calendar clearly marks when things are, and Canvas should tell you when they are. But don't start assuming, I see the pattern, it's this. Well, it may be a pattern for 2 weeks, but then that third week, the pattern changes. So do pay attention to the calendar. The dates do get a little funky in some spots. When things are due, they're due, at 11:59 p.m. of the evening of the date posted on the calendar. As I said before, videos and quizzes, assignments will be up typically a week before you need to access them, a week before they're due, before you're supposed to be listening to them, so you can work ahead a little bit. But I'm not going to put a lot up much more than that because if you're cramming a semester's worth of stuff into 2 weeks, I know you can't do that at a deep processing level. You're doing very shallow processing. And what's the point of that? Just getting through a class. Hopefully you're here to learn something. I'm certainly here to teach you something. But if you know you're going to be out for more than a day or two, we have this cruise that's been planned. I'm going to be out. Could I get this thing a little early? Could I take this quiz early? Let me know. I'll work with you individually on that on a case-by-case basis. Okay, and the rest. Academic integrity, super important to me, both in terms of your quizzes and exams, doing them on your own, not using internet resources that you're prohibited from using. But the thing that trips most people up, I've had a couple people with quizzes that have had some consequences, but mostly it's with research papers, not citing appropriately, engaging in plagiarism. Typically unintentionally. I've had a couple of intentional ones. They are no longer with the university. But even unintentional plagiarism, it's probably not going to get you kicked out, but you are going to lose some points in the assignment, maybe even a letter grade. So if you're not sure that you're citing appropriately, not sure how to cite appropriately, ask me questions. And I'll put a video up on our webpage that's not required, but just about how to cite things appropriately. If you're ever unclear, ask me, ask the Writing Center. Do take advantage of the Writing Center, as I've said a couple times. I think it's a real asset to the university, and you're paying for it. It's in your student fees. Whether you use it or not, you're paying for it, so might as well use it. If you have concerns about an instructor or class, if it's me you have concerns about, obviously, please come to me first. If you're not comfortable coming to me, or you come to me and I don't address your concerns satisfactorily, the next step in the chain of command would be go to the dean. Dean Hill is the Dean of College of Education. For any other faculty in the department, if you've taken other psych courses, if you have concerns about them or their course, again, please go to them first. You are all mature adults, and this is kind of what's expected of you at this point. Raise your concerns with them. If they can't address them satisfactorily, then the next step would be to take them to me. And then if I can't address them, again, you'll escalate to the dean. And if the dean can't address things satisfactorily, you escalate them to the provost, and she's kind of the top of the food chain here. Workload. So wrote a good bit about this in the syllabus. I won't say it all again here, but yeah, this class is a lot of work. All classes should be. But this is a 16 weeks of material smushed into 8 weeks. So if you start taking this course, like, wow, the level of reading, the amount of time I spend on this is twice as much as I would in the fall or spring. Yeah, it should be. It will be twice as much because we have to do the same amount of learning in half the amount of time. So that's why the limit on how many classes you can take is smaller in the summer than the fall or spring, because the workload on a week-to-week basis is much higher. So just want to let you know that I understand that. I want to make sure that you also understand that. You understand that that's kind of my expectation. Finally, relevance of this course. As a clinical psychologist, obviously I think this is one of the most important classes you'll ever take. But even beyond that, so for any of you that are interested in possibly working as a psychologist, as a counselor, as a therapist, and we do have grad programs for those vocations, this is going to be a super important class for you, because you'll be working with people and you won't necessarily be diagnosing them. But when we talk about abnormal behavior, when people come to counseling, come to therapy, there's usually something abnormal, something different about the experience that's bringing them in. It may or may not rise to the level of pathology, but it probably will be in the realm of abnormal behavior somewhere. Something out of the norm is bothering them, causing them difficulty. So it's good to have kind of some base level understanding at the undergraduate level. For anybody not going into a counseling profession, social work profession, I think this is still a super valuable course, because every person will either at some point in their life meet criteria for a DSM disorder or know someone that meets criteria for a DSM disorder. Every person that lives more than 20 years, I'll put that limitation on it. It's pretty common. We say abnormal. It's pretty normal to have some distress and some dysfunction in terms of your behavior. It's fairly normative. It's just that there's so many different ways that behavior can be abnormal. That, oh, I have this one thing. Well, I don't have that, but I've got this other thing. So you may deal with things we talk about in this class. People you know may deal with things we talk about in the class. And again, this class isn't going to prepare you to be their therapist, but hopefully it'll give you some background information to give you some better understanding. And understanding often leads to greater acceptance. It will also hopefully prepare you to know how to look for more information if you have questions about different disorders or pathologies or abnormal behaviors, so that you can go and do your own work, furthering your knowledge for things you're interested in. Anyway, I think it's going to be a great course, and I look forward to working with you all this summer. Take care.